Okay, well, hi there, everybody. I am Dr. Steve, and here is your Start Your Healing Now for patellofemoral pain, jumper's knee, any pain kind of in this front region of the knee. We can start some healing and get you moving now as you are not sure what to do or where to start. So here we're going to start. So with this, what we're going to do is for part two, we're going to go after the sides of the body and the side of the hip because in part one, we went after the anterior chain. In part two, we're going after this opposite side lateral chain on the outside part of the body. And then in part three, we're going to hit some of the posterior chain. But here we're going to use the wall. So I'm standing next to the wall. And I've got kind of the grid here to try and help give you a little reference points for the visuals. But what's going to happen is the foot closer to the wall steps across in front. So we want to be careful not to have the foot too locked into the other foot, because what that's going to do is limit how much your knees can move. We need the knees to have a little bit of wiggle room. So we're next to the wall, the foot crosses over in front. There's a little bit of space kind of forward with the foot because that gives the knee some room. Outside hand comes up and over to hang on to the wall. And we tend to call this one the banana stretch because the body is in this big kind of banana curve. So having the hand onto the wall is a big part of all of this. And then we take the pelvis and the hips and we start to wiggle in the different directions. So we're going to do forward and back here. I'm going to do a little bit of wiggling forward and back. Then we're going into some side to side here, sinking into the wall and then away from the wall, into the wall and away. And as we do that, we're creating, oops, we're falling out with the earpiece. Get that back in there, back into position here. So sinking the hips into the wall and away, and as the hips go away, then you're sinking deeper into that stretch. And then we're going to do the rotation. So we're rotating, twisting the body into the wall and away from the wall. And as we have all of this stuff on the side of the body lengthened, so IT band, gluteus medius, latissimus, dorsi, all of those parts are getting a good stretch and lengthening through there. So now we're going to do the other side. So here you can get this view, but next to the wall, foot crosses over in front, that outside hand comes up and over the top. So we're in this big banana curve here, kind of that gentle curve. And then we start taking the hips and we do our wiggle forward and back. We're going side to side, sinking into the wall and away from the wall. And as you sink away, you get a little deeper into the stretch. And then we're going to do a little twist and rotation back and forth. So we're turning the body towards the wall and then away. One of the tendencies is that this outside hand or this hand up on top, it will want to spin and pull away when there's stuff that's tight, especially in the latissimus and the arms, the armpit, that relates to kind of tightness through the system and the side of the body. So now let's see if I can do this to change the camera angle a little bit and bring it back, because what we want to do next is go into a little karaoke squat walk. So after we've just done some stretching through the sides of the hip, we want to do a little lengthen and strengthen. And so what we're going to do is the braiding step or karaoke step, stepping across, go into a squat, wide into a squat, and then we're crossing behind into a squat. So we're going out, squat, across in front, and I'm going to come back so that I can stay on camera, but that we're stepping across in front with a squat. You step out wide in squat and then step behind and squat. And we keep that pattern going. Normally, you can walk a little distance here doing this, but to stay on camera, I just wanted to be able to demonstrate that. So there we're getting some mobility and some lengthen and strengthen for the sides of the body and the side of the hip into this opposite side lateral chain is what we call it, but all through the IT band and gluteus medius and latissimus dorsi and getting all the parts to move. So there is part two. We, in part one, did the hip flexors. Part two, we're doing the side of the body. Part three, we're going to hit the posterior side of the body here in just a moment. And so be sure to stay tuned and watch for part three, where we're going to finish off our Start Your Healing Now related to knee pain and patellofemoral pain. So if you haven't, be sure to like, subscribe, share, and pass along these videos to anybody that you know that could benefit from them. And if you or anybody that you know are struggling with pain, don't suffer. Come on in and let us help. Until next time, bye-bye, everybody. Keep moving.